This is Radio Health Journal. I'm Reed Pence. This week, the dark side of medical crowdfunding.
There are clinics who are happy to take the money of these customers, the crowdfunded money, and to offer similarly bogus treatments.
Scammers who take advantage of desperate patients when Radio Health Journal returns.
I'm Nancy Benson, host of Radio Health Journal. If you enjoy listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
Why do people think this is me? Why do people think I'm gonna steal?
The lasting impact of feeling like an outsider no matter where you go. Then,
we can't write off a day, we can't write off a year. We have to always be able to stop and say, there was something good in here, and I have to be able to find it.
There's always something to be grateful for. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Viewpoints on your favorite radio station and subscribe and listen to shows anytime on Apple Podcasts and Google Play.
Raising money for a good cause is nothing new, and some methods have been around for a long time. Salvation Army bell ringers have manned kettles at retail stores around Christmas time for decades. But today, the causes have grown to individuals as well as charities. And with COVID-19 costing millions of jobs and the health insurance that goes with them, the need is bigger than ever. Crowdfunding websites are growing as a result. The biggest of the crowdfunding sites, GoFundMe, went online in 2010, and since then, campaigns there have raised more than $9 billion, more than a third of it for medical treatment or something related to it.
It's been a literal lifesaver for some people, getting them treatments that they wouldn't have gotten otherwise. For a lot of people, it has helped them to avoid medical bankruptcy. So there are actually some studies out there that have looked at medical bankruptcy in line with the rise of medical crowdfunding. And instead of some people losing their houses or devastating their savings, they're being able to rely on friends and family and maybe even strangers to help them out and make it possible for them to access this care.
That's Dr. Jeremy Snyder, professor of health sciences at Simon Fraser University in Vancouver, who's looked into a variety of aspects of medical crowdfunding.
It makes it easier as well. You've got sort of a central place where you can post up about your medical needs, post updates, post videos, keep everybody informed. Instead of somebody taking the time to try to coordinate donations from your network, they can all just hop onto that one crowdfunding page and put in their credit card numbers or bank transfer information and get that all done. So I think for some people, they really can relieve some of the stress of trying to get through a medical emergency.
Sometimes crowdsourcing for medical purposes, for gaining access to treatments, is great.
Dr. Art Kaplan is head of the Division of Medical Ethics at the New York University School of Medicine. He's also studied medical crowdfunding.
It lets people who just don't have insurance or getting swamped by copays raise money. Sometimes there's a clinical trial that somebody wants to get their child to. They need travel money. They've got to take time off from work, and crowdsourcing on the internet can really make that possible. So I've seen many, many, many instances where crowdsourcing works very well. Efforts to get legitimate things and people get access. I also know that it sometimes helps to raise money for research.
But crowdfunding for medical purposes often goes only so far.
We looked at a randomized sample of crowdfunding campaigns from across the United States, and we found that only about 10% met their financial goals. So in general, we think of crowdfunding as a very poor kind of safety net for our somewhat dilapidated healthcare system.
That's Dr. Nora Kenworthy, Associate Professor of Nursing and Health Studies at the University of Washington, Bothell.
The largest number of campaigns we saw was for cancer and cancer-related treatment. In addition to a large number of campaigns that spoke about being either uninsured or underinsured, we also saw a lot of campaigns that had a lot of additional care costs arising from largely chronic illnesses that were causing an undue financial burden for families and caregivers. So there's a lot of campaigns for transportation to the hospital or paying for someone to watch the kids while someone's in the hospital. And those are not traditionally the kinds of things that we think of as healthcare expenses, but they are the expenses of illness and injury in the United States that aren't covered.
Despite the good causes, crowdfunding has been characterized as digital begging. And as it is with any kind of appeal for money, from direct mail to panhandling on the subway, Kaplan says some kind of people win and some lose.
The people who reach their funding goals tend to be people raising money for children, people raising money for specific children. That is, if I say my son Johnny needs to get X. Younger people, it's what I sometimes call mediagenic people. They have good-looking parents, they own a dog, they're articulate, they can sort of lay out their case well. Those are the ones that tend to do the best.
There's a lot of public concern these days that GoFundMe is a sort of elaborate popularity contest. We're also really concerned about people who have stigmatized conditions. I'm yet to ever see a campaign for a sexually transmitted disease on GoFundMe.
But even small amounts of stigma can doom a campaign.
And then there's ample room for other kinds of social biases, including racial and gender biases. We've seen how on other platforms, these biases tend to get amplified by algorithms that are embedded within sites. And it certainly seems plausible that that would be the case here. We're continuing to do research on it.
So while some people laud crowdfunding as a way to democratize charitable fundraising, that's not exactly true. Fairness is a big issue.
Crowdfunding may actually be least useful for the people who need it most.
If your education levels aren't quite there to where you can really convey a compelling story about yourself, make really engaging videos, maybe you don't have media contacts, or your social network, maybe it's a large one but not a particularly wealthy one. These are the people that the evidence shows aren't going to do all that well. Whereas medical crowdfunding does help out a lot of desperate people, absolutely. The most desperate, the most people who maybe don't have those educational attainments, aren't from wealthy neighborhoods, don't know a lot of people who have the means to help them out, maybe they're new to the country, don't speak the dominant language. These are the people who are probably most in need in our society, but unfortunately, they're the ones who are least prepared to take advantage of medical crowdfunding.
However, for most people, a slick website and compelling video won't make that much difference. For them, a campaign on GoFundMe is simply a way to let friends and family know their need, and that's who contributes. Their campaign isn't likely to go viral. And if you think a video is a little too slick or the story too heart-tugging, studies show that sometimes you're right.
In looking back over 10 years, they found dozens of cases of people misrepresenting their identity, fundraising for someone else who didn't exist, situations where people were exaggerating their illness and had been caught. So these are just people who've been discovered, or impersonating somebody else. So flat-out fraud is a part of the crowdsourcing world as well.
In some cases, you'll see people who outright lie about their medical conditions, or they hear about somebody who is, in fact, in need, but take on their personality. In other cases that I think are accurately described as fraud, you'll have people who just change their minds about what they want to actually use the money for.
Other times, the patients are real and all too desperate. Easy pickings for shady health providers making big promises.
People on the internet who were trying to crowdsource were sometimes chasing what we would call bogus or charlatans or quackery or just unproven treatments, things that maybe there's some people who are proponents, but the evidence doesn't really say this is going to help you.
People are putting that money to proven interventions. These are stem cell interventions that don't really have science to back them up. Other cases, it's homeopathy or naturopathic kind of treatments that don't really have any science to say that they're efficacious. And in those cases, I think the worry is that not that people are trying to mislead the public or engage in fraud, but the money is essentially being wasted.
Kaplan's study focused on 4 crowdfunding sites that hosted campaigns for 5 treatments that are scientifically unsupported, experimental, or possibly dangerous.
And we found overall nearly $7 million during the 6-month period that we reviewed. And people were asking for $27 million, so there was a shortfall. But the homeopathic and naturopathic quack cures, I would say, for cancer got up to $4 million, and a lot of these campaigns exceeded their goals for individual cases.
Snyder's study was similar. It looked at campaigns for unproven stem cell treatments on just 2 crowdfunding sites.
In those cases, from about 300-odd clinics, we found over 400 crowdfunding campaigns. And interestingly, about 2/3 of those were for only 2 clinics, and these were ones that had told their customers to go ahead and crowdfund. So we're really urging people to go ahead and do that. And so we think that some companies might actually start to see this as a way to generate a new revenue source. But that's really the tip of the iceberg.
So who's looking out for patients in cases like that? Snyder says not really anyone.
There are some actions being taken in the U.S. The FDA has sent out warning letters to some of these clinics, and more recently, the Federal Trade Commission has sent out warning letters and lawsuits, in fact, in some cases, against clinics that are making advertising claims that aren't actually backed up. And I think that's really important and something that should keep happening. But the problem is, if you knock down these clinics in the U.S. and in Canada, they're going to crop up in other countries. And in fact, in Mexico and Eastern Europe and India and lots of other countries, there are clinics who are happy to take the money of these customers, the crowdfunded money, and to offer similarly bogus treatments.
You really can't blame patients who don't want to go down without a fight when insurance or physicians say there's nothing else they can do. The alternatives are few. Kaplan says the combination of desperate patients, hopeful donors, and no oversight make fraud nearly inevitable.
We weren't shocked. I mean, we weren't surprised. Companies like GoFundMe and the other carriers, they just take a cut of the monies raised, so they're not really interested in getting all that picky about whether it's a good campaign or a bad campaign. Most of these places take 4 or 5% of donations and charge a processing fee every time somebody donates, so that's where they're making their money. But it doesn't incentivize them to say, hey, is this fundraising legitimate? Is this a quack clinic in Fiji that's someone's trying to get to, or is it really something that they should be in a clinical trial, not just raising money from some doctor who says he can or she can cure them? So no, not surprising to see a lot of fraud and hanky-panky and greed kind of on display, but it's there. There it is.
The experts say crowdfunding websites have an obligation to better police fraud on their sites. Medical crowdfunding has the potential to help many people who've fallen through the holes in the safety net. But for now, it's up to donors and patients to watch out for themselves, and they typically don't have the resources to do that much research. As a result, millions of dollars could be wasted on false hopes. You can find out more about all of our guests on our website, radiohealthjournal.org. I'm Reed Pence.
About 90% of the 3 million Americans who have epilepsy take medication, but nearly 60% still have partial onset seizures. For 35-year-old Matt, his future was put on hold.
With my first seizure, I had to give up sports, driving, and finally, my plan of being a firefighter. But with medication, my seizures were cut in half. And right now, it stopped them. Now I'm working towards new goals.
Matt was prescribed Xcopri, cenobamate tablets. In studies of adults with uncontrolled partial onset seizures, Xcopri demonstrated significant reductions in seizure frequency compared to placebo. And as many as 1 in 5 patients achieved 0 seizures during the maintenance phase. Individual results will vary. It is always important to talk to your doctor. Xcopri is a prescription medicine used to treat partial onset seizures in adults 18 years of age and older. Do not take Xcopri if you are allergic to cenobamate or any other ingredients in Xcopri, have familial short QT syndrome that affects the electrical system of the heart. Xcopri can cause serious skin rash or other serious allergic reactions which may affect organs and other parts of your body. Take Xcopri exactly as your healthcare provider tells you to take it. Xcopri may cause problems with the electrical system of the heart, QT shortening. Xcopri may cause suicidal thoughts or actions in a very small number of people. Do not drive or operate heavy machinery until you know how Xcopri affects you. Do not drink alcohol or take other medicines without first talking to your healthcare provider. Call your healthcare provider right away if you experience any of the serious side effects. Do not stop taking Xcopri or stop other medications without first talking to your healthcare provider. Xcopri may cause your birth control medicine to be less effective. Talk to your healthcare provider about the best birth control method to use if you are or plan to become pregnant or breastfeed. The most common side effects include dizziness, sleepiness, headache, double vision, and feeling tired. Xcopri is a federally controlled substance. It can be abused or lead to dependence. Talk to your doctor about Xcopri. Visit Xcopri.com or call 866-657-5574 to learn more.
And that's Radio Health Journal for this week. Radio Health Journal is a production of MediaTrax Communications. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.
Coming up next week on Radio Health Journal.
Typically, by the time the tumor is seen on a CT scan, it's still late. By the time you see a 2-centimeter tumor, it's nearly 7 to 10 years old, and even some research has shown that it could be all the way to 15 years old.
Solving the low survival rate of pancreatic cancer.
Then, what a doctor may learn when patients open up about their whole lives.
One little thing, when you don't have much money, really can just explode into your life turning upside down.
All that and more on Radio Health Journal.